So patient, I'm going to get you to turn and face the board for me. Now, remember I told you the lateral scapula is very similar to the scapula. The difference really is the placement of the arm and the central ray. So with the scapula, we kind of exited out of the joint space. Here, we're going to exit, or we're going to enter and come through the middle of the scapula, the body of the scapula. Well, two different places you can, well, three different places really that you can put the arm. Ideally, the best place to put the arm for a lateral scapula is the back of the hand on the back, okay? Look what that does. It really pops that scapula out, allows you to see it very well. Doing this shows you the acromion and the coracoid. Your book says, what's the word they use? Delineation of the coracoid and the acromion. Delineation just really means you're seeing kind of the outline, the borders of it, and you're seeing it as you should be able to see it accurately, pretty accurately. So doing this method will show that to you. Crossing the arm over the chest like this is another option, and that method is supposed to show you acromion and coracoid. So look at this in the book though real quick. If you look on page 263, Chris, you can come over here. If you look on 263, the top images, this is with the hand behind the back. Notice how well you can see the acromion and the coracoid, right? You can see them. If there's a fracture in that area, the radiologist can be able to see that. Down here, this is done with the arm across the anterior chest. Is it as easy to see the coracoid and the acromion and that as it is up here? Mm-hmm. It's not, is it? Keep that in mind. You see a lot of techs doing that, just taking the arm and coming across the chest like that. But to me, it's just not as pretty as that arm behind the back. Now let's say the patients come in and the doctor is more interested in the body of the scapula versus the coracoid and the acromion. Then you would bring the humerus and put it on top of the head, okay? And then we're just looking at the body of the scapula. So the picture on page 262, that's how we're doing it for checkoff, and that's how I want to see you guys doing it when you're practicing, okay? So let's put you back up here. We're going to put your arm back behind your back. I'm going to turn him at an angle. What am I lining up? What did you line up for your scapula?
Top of the scapula and then the
So AC joint and the superior angle of the scapula. This is very easy to palpate. Superior angle here. AC joint. The AC joint is the acromial tip, y'all. The acromial tip meets at the AC joint. So those are the same two things. You've got to make an invisible line from the superior angle to the AC joint, and that line has to be perpendicular to the center of your IR. Okay? So I'm going to line those up. Just about perfect there. And then here, the border, see the border of the scapula there? I can take my hand and I can kind of do like this. My thumb is going to be the inferior angle of the scapula down here. Okay? So I have to come down, and I'm coming through the middle of the medial border. This is the medial border of his scapula, what's closest to the spine, right? So make sure you've got inferior angle included. Just a little bit more. Central ray is coming in, medial border. I've got superior angle and AC joint perpendicular to the IR. I'm going to put my right marker. This is his right arm. Just like that. I'm going to shield my patient. Now, breathing technique. Hold your breath, don't breathe, don't move. That is a lateral scapula. Very similar to what you did with the scapula, right? Make sure you've got the entire scapula on the image. think that's kind of close, isn't it? Here we go. Questions? Okay, Chris, you can relax. Thank you.